Thank you, Mr. President. I rise tonight to talk about yet another health care debate that we're having here in the Senate. As many people know who've been following this over the last number of months, we had a long debate and then a vote here at the end of July. And at that point, despite all of the conflict and all of the debate and arguing really about health care for not just months but for years, we moved to a new chapter. And that new chapter for a number of weeks has been very positive. When I went home to Pennsylvania, I went to 32 counties in the month of August, and in a lot of those counties I tried to give a bit of good news on health care despite all of the conflict about it. I was able to say that since July the 28th, when the vote was held, we had very positive bipartisan discussions. I was part of several of them. And the chairman of the Health, Education, Labor, Pensions Committee, so-called HELP Committee, Senator Lamar Alexander from Tennessee, announced in agreement with Senator Patty Murray of Washington that they were going to preside over bipartisan health care hearings in that committee. Probably the first bipartisan hearings in a long time. And what that meant was we were going to finally have hearings and a thorough examination of a few issues, not a sweeping bill that would repeal the Affordable Care Act and decimate Medicaid like the prior bills were, but to take elements or pieces of some of the challenges that we have before us and try to fix those problems. And that took place over the last 2 weeks. Among the most positive health care moments we've had in the Senate in a long, long time. What did we do? Well, we were focused on making sure that the cost-sharing payments were made, hoping we can get a bipartisan bill on that in the next couple of days, and focusing on problems in the individual market. Real problems, serious attention to serious issues. Not a game, not a political exercise, not an ideological exercise. Democrats and Republicans sitting down, working together in the HELP Committee to solve some of, not all of, but some of the problems in our healthcare system. It's been a very positive development for the committee, for the Senate, and for the nation. There's a little more good news. Both parties have come together to make sure that the Children's Health Insurance Program continues. One of the most important programs I know in Pennsylvania. These are approximate numbers, but about 175,000 children in Pennsylvania get their health care that way. So both parties were coming together on that as well. Very bipartisan. CHIP, since its enactment way back in the mid-90s, has been bipartisan. A couple of rocky roads here and there, but mostly for 20 years, bipartisan. And it would be again in this at this time in the Senate. And it's very personal to me. My father was the governor of Pennsylvania in 1992 when CHIP passed. I think we might have been the largest state with a children's health insurance program. And those kinds of state models became a basis for federal legislation. So deeply personal to families across Pennsylvania who absent the CHIP program, would not have health care. Same is true of Medicaid, which of course is a much bigger number. A lot of children in the country have health care solely because of Medicaid. Some adults have health care solely because of Medicaid, millions of them. And I think when we have these debates, we should remind ourselves about the value, the importance, the significance of these programs and the consequence of undermining them or wiping them out. In the case of Medicaid, what some earlier versions of the Republican health care bills would do would be to decimate Medicaid over time. Maybe not in year one or year two, but over time would have a terribly devastating impact on Medicaid. Well, what's Medicaid? Well, it just happens to be the program where 40 million children, or I should say 40% of all children get their health care. 60% of all children with disabilities get their health care. About 2/3 of nursing home care is paid for by Medicaid. Ask a family member that has a loved one with a disability what Medicaid means to that family. It is life or death, Medicaid is. So I know we have debates around here where people talk about Medicaid as if it's just another program, just another budget matter, just another health care talking point, right? Well, one of the reasons why these bills have not passed is because a lot of Americans, Democrats and Republicans and independents, out there, far away from Washington, realize what would have happened here if we passed some of these bills. What would happen to the Medicaid program that covers more than 70 million Americans? No one here would lose their health care, by the way. No senator, no House member, or their families would lose their health care. But folks here were perfectly willing to support legislation which would result in millions, not a few million, double-figure millions, 15 million maybe lose their health care on Medicaid if these bills had passed, and several million more in the exchanges or otherwise. So that's what we were debating. But as I said, since July the 28th, we've had a lot of bipartisan moments, and that's a good thing. So where are we right now? Well, here's where we are. With a piece of legislation, the shorthand is Cassidy Graham, two senators who are leading the bill. What would it do? Well, it would do a couple things that we should never allow to pass, in my judgment. Establishing a per capita cap on Medicaid. That's a bad idea. We should reject that. Ends Medicaid expansion as we know it. The part of Medicaid that now covers 11 million people, and I hope that folks don't start talking about in the context of how difficult it is for states and counties and communities across the country to deal with the opioid crisis. I hope they don't say that we're going to pass a bill that will end Medicaid expansion as we know it, because we know the biggest payer, the program that has the most impact on treating people who are in the grip of the opioid epidemic, who are gripped by that addiction, Medicaid expansion provides more help than any other program. 68,000 Pennsylvanians at last count with an opioid issue got their help from Medicaid expansion. Solely because of Medicaid expansion, they can get help for opioids. So ending the Medicaid expansion as we know it is another bad idea. Rolls back protections for Americans with pre-existing conditions. I thought we settled this, that this would be a guarantee going forward, that no matter what bill, Democrat, Republican, or otherwise, we would make sure that that was a national standard, that no one had to worry about pre-existing conditions again. Well, here we are again, concerned what might happen as a result of this legislation and what a state might do to take away the protections of pre-existing conditions, because they waive it, and they're allowed to waive it under these bills. Allowing states to impose burdensome work requirements as a condition of coverage. That's another result of the bill. Taking coverage away from millions of Americans. We mentioned that, but it bears repeating. This isn't just a policy debate. This is about folks that we all represent. I represent families in Pennsylvania, many of whom wrote to me, have contacted me, telling me their stories. One of them was Pam Simpson. She's from southeastern Pennsylvania, Coatesville. Her son, Rowan, was diagnosed on the autism spectrum a number of years ago. Prior to having the protection of Medicaid, what we call in Pennsylvania medical assistance, that family had a big challenge. Challenges continue even after coverage. But what Pam said to me in a letter was how much benefit there was to her family in terms of getting the treatment and the help from Medicaid. She said, and I'm quoting from her letter, "Without Medicaid, I'm confident I could not work full-time to support our family. We would be bankrupt, or my son," meaning Rowan, "would go without the therapies he sincerely needs." So there's a child, I think he was 5 years old when he was diagnosed. There's a mother telling me that their life is a lot better because they have the protection of Medicaid, because their son has a disability. And there are a lot of families that the child might have more than one disability. And even some families that have even wealth or really good health care coverage. They still need Medicaid if they've got a child with a profound disability. So this isn't just about one group of Americans. This cuts across all incomes, all regions, all parties, all beliefs. That's what Medicaid does. Because you know what Medicaid is? It's an American program. We're the greatest country in the world. We can have the strongest, and we do, economy in the world. We have the strongest military in the world. And we can do all that and still have a program that says to any family that has a loved one with a disability, we're going to help you. We don't care where you live. We're going to try to help you because your family member has a disability. Or if you're low income, we're going to make sure that your child has health care and gets all of the excellent screening and diagnoses that take place early in a child's life to prevent disease, to prevent all kinds of challenges in the life of that child. Because we're a great country. We're called America. That's what America does. We take care of people that need help. And if it costs some more, we find the money to do it. Just like we find the money when we have a conflict to protect our security. We all come together as a country and we protect the country. Well, it's about time Washington came together to protect people that have the benefit of a great program called Medicaid or other health care programs, because that's what a great country does. If we do to Medicaid what some here have wanted to do, we will be diminished as a country. We will all be diminished. Do we want to live in a country where we just had 20 million people gain health care coverage and go backwards? Have more people without health insurance? Have more children lose their Medicaid coverage? Is that the country we want to be? I don't think so. I don't think any Republican believes that. I don't think any Democrat believes that. If you call yourself an American, because that's what America does. We take on big challenges and we solve problems. So Medicaid is not the problem here. We got problems in our healthcare system. Medicaid's not one of them. Medicaid is helping a lot of people, and we're going to protect it. This idea that we've come together in the Help Committee on fixing parts of the system we got to fix and do a thorough examination and have hearings, isn't that a radical idea? I know that I just heard in the last couple of hours, there's a health care hearing on Monday. Oh my goodness, isn't that wonderful? So there'll be a hearing on Monday, and I guess they want to pass the bill on Thursday. That's what counts for thorough examination or regular order of one of the most complicated challenges we have. Why don't they agree to do it like Lamar Alexander did as the chair of the Help Committee? He said, we're going to take these discrete individual challenges and examine them closely, come together on a bill, and then pass the bill. And then we're going to move to the next problem and the next challenge and solve them one at a time or two at a time. Not take a meat axe to Medicaid and hope it works out for people that don't have any health care coverage. That's what a great Senate would do. We would have months of hearings on this bill that some people want to pass by the end of September. But I'll go back to the positive plane that we've been on. Good work in the Help Committee on some issues. Good work in the Finance Committee on the Children's Health Insurance Program, getting it reauthorized. While all that collaboration is going on, all of those good discussions, all of that back and forth about policy, no yelling, no screaming, no finger pointing, all the while, just in the last couple of days, this bill is moving through Washington, quietly, but it's moving, and it's starting to pick up momentum. Like a snake in the grass, that's what this bill is. Like a snake in the grass. You may not see it yet, you may not know much about it, but it's coming. And if they pass it next week, you may not feel the impact in 2017. You may not feel the bite of that serpent in 2018. You may not feel it in 2019, but you're going to feel it. And if we allow that snake in the grass to inject its venom into people, my analogy for losing your health care coverage, then we're not the Senate we should be. We're not the government that we should be. We should be an institution, the United States Senate, that protects people from those kinds of adverse consequences. And this bill is that kind of a threat to people. It will bite, and that bite will have a lot of venom. Why do I say that? Well, think of what would happen to the Medicaid program. By one estimate, starting in 2027, funding would be cut off completely, leaving 32 million Americans without access to health insurance of any kind, and leaving states with zero federal dollars to replace Medicaid expansion, marketplace tax credits, and cost-sharing reductions. So please don't make the argument that Medicaid is going to be just fine. When you're block granting it, which is a rather benign description of giving a block of money to a state and hoping that it works out, hoping that it's enough money, enough funding to pay for that state's Medicaid needs. What if you have more children with disabilities? What if that number grows? This bill basically says to the state, good luck, state, which has to balance its budget, by the way. Federal government doesn't do that. The state has to balance their budget, and they, by definition, will have to cap services and treatment to people with disabilities. So that's what this is all about in the end, about sending the problem back to the states, calling it flexibility. Isn't that a nice word? All these benign words, flexibility, block granting, per capita caps, they all sound so benign. There's a lot of venom in those policies. What does it mean for one state? I'll just give you one example. In Pennsylvania, we had more than 700,000 people obtain health insurance through Medicaid expansion. Over 700,000 people. In the marketplace, the exchange was over another 400,000 people. So more than 1.1 million people got health care in one state through Medicaid expansion or through the marketplaces. How about rural Pennsylvania? We have 67 counties. How about the 48 rural counties in my state? How many of them, how many people living in rural Pennsylvania got health care? At last count, it was over 278,000 people, almost 280,000 people. 180 obtained health insurance through the Medicaid expansion, and the balance was through the exchanges. So what are we going to say to rural Pennsylvania? I know 180,000 of your neighbors and friends and family members got health insurance through the Medicaid expansion, but we're going to wind that down, and you'll be just fine. Don't worry, Washington will guarantee that you're just fine. That's a big lie if you try to make that argument to rural Pennsylvania and to other parts of our state as well. What do we say to rural hospitals who have very thin margins already, some of them on the brink of having a major problem, and depend upon the support they get from Medicaid? Because in rural Pennsylvania, we've got a lot of folks that have illnesses and challenges that maybe some of the rest of us don't have. And they tend to be older folks that have those challenges too. What do we say to them? We're saying to them that we're just going to wind down the support that Medicaid provides in a state like Pennsylvania. So my plea to my colleagues is, don't allow this snake in the grass to get close to anyone and to bite them and inject venom in them. Don't allow that to happen. Don't allow this bill to rip away health care from millions of people. Just like the bill before that and the bill before that. Work with people in both parties to do what we're doing in the Help Committee and to a certain extent, although very limited, in the Finance Committee. But I think we have a good model to work together. But I can't go back to Pam Simpson and say, Pam, you know what, I know you're happy with the Medicaid that Rowan is receiving, and I know it's working out for you, but you know, there's some people in Washington that just had a different idea for you, so you're on your own. You and your family are on your own. I don't think that's what we do as Americans. Forget being senators. I don't think that's an American thing to do. We help people that need help. all of us in our lives need help at some point or another. No one is immune from some of these challenges. I'll just read one or two sentences from the end of the letter that Pam Simpson wrote me months and months ago, at the early part of this year, when she talked about how important Medicaid was to her. And she's pleading with me at the end of this letter to protect her son and protect her family. And I would just ask that my colleagues consider this when you're considering how to vote. Pam talked about all the benefits that Medicaid provides her son because of his disability and their family. She said, please think of Rowan, my son. Please think of, she says, please think of my husband and me. But then here's how she concludes. Please think of my 9-month-old daughter, Luna, Rowan's younger sister. Please think of my 9-month-old daughter, Luna, who smiles and laughs at her brother daily. She will have to care for Rowan later in her life after we are gone. Overall, we are desperately in need of Rowan's medical assistance, Medicaid, and would be devastated if we lost these benefits. I hope we can all say to Pam Simpson and her family, and any family that benefits from Medicaid or Medicaid expansion or the protections of the Affordable Care Act, we're guaranteeing that you're going to have those protections. We're going to guarantee that those protections are going to be there for you. I hope that every member of the United States Senate can say that and vote in accordance with that promise. And I would, to use an old expression, ask members of the Senate to examine your conscience. Is this what you want people to remember you for, this kind of a vote? Where Rowan's mother has to worry, or Rowan has to lose his Medicaid coverage, or a poor child in a big city has to lose their health care coverage, or a child in a rural area, or someone working at a rural hospital loses their job because of these massive, ideologically driven cuts to Medicaid? I hope you can answer the call of your own conscience when you vote that way. Mr. President, I would yield the floor.